This podcast contains our own personal views not associated with any organisation. Coronial contains descriptions of death inquests that may be graphic and disturbing to some listeners. Discretion is advised.
You gave me the pedestal fan.
No.
I raise you
I feel like
a chest of drawers.
someone slammed their heads
Yes.
into a bedside table, didn't they?
No.
The corner of it?
No.
Oh, did it fall on them?
No.
Were they picking it up?
No.
So no head.
Was it levitating?
I genuinely don't think you could ever guess this. Like,
They
it is
shut
just...
their hand in a drawer.
Yeah, but
and
that
that
would
killed
kill
them?
you.
Well, shut it really hard. It bled out. I don't know.
They were crushed by it.
No.
They were painting it and they died from paint fumes.
A splinter.
I couldn't really blame the drawer. The splinter got infected and they died.
No, the splinter went into its jugular vein and ripped it open.
From the chest of drawers.
Yeah.
Again, with the, like, how do you blame the chest of drawers? And that. Anyway.
A chest of drawers fell off the back of a ute as it was being driven somewhere and it hit someone's car and they died.
And it hit the car and that's what caused the death. Again, is that
Was
not a
the
car
bedside
crash?
table in the bedroom?
Yes.
Okay.
Was there an earthquake?
No.
I think we just need you to tell us.
No, I like this game. Was there choking involved?
Yes.
Yes. Okay.
How do you choke on a chest of drawers?
That is a good question.
Was it
What
something to do
you're
with the
about to
knob?
learn.
Was it something to do with the knob?
knob?
No.
Oh.
No knobs.
Foot?
There were no knobs involved or mentioned.
Was there a foot on
No.
the chest of drawers?
I mean, there might have been a foot on the chest of
Probably
drawers,
were
but,
feet,
Did they choke on something from the chest of drawers?
no.
They choked on something in the chest of drawers. They choked on an entire chest of drawers.
They were they sleeping and they leaned against the chest of drawers and the chest of drawers pressed on there.
Getting closer.
Okay.
Okay, that's crazy.
Anyway, welcome back, everyone, to Coronial. And today I'm going to be telling you about the death of John Frederick Reimers. And he went by the name of Fred. So he's going to be referred to as Fred from here on out, just so we're all aware. Mm-hmm. This coronial inquest occurred as the death was unexpected. And the inquest was held as the coroner felt that there were matters of public health and safety that warranted further exploration through a public hearing. So Fred was a 63-year-old gentleman at the time of his death, and he resided in the Mayflower Residential Aged Care Facility that's north of Melbourne. He was declared deceased at the facility in the early hours of the 17th of December 2016, and he'd resided in that facility for 18 months at the time of his death. He had a wife and 2 children who lived nearby, but Fred had previously suffered from a stroke, which left him with left-sided paralysis. He required a walking stick or wheelchair for mobility. Along with those physical side effects, he'd also suffered a change to his personality, including frustration at his loss of independence, impatience, agitation, and sometimes violence. And this is ultimately what had led to him moving into the aged care facility, as his wife was no longer able to care for him safely at home because of the risk to herself from his violence. And it is of note that during his time at the aged care facility, Fred had suffered a number of falls from his weakness. So that, you know, potentially he was still trying to be independent, but not quite willing to accept his limitations.
Yeah.
Well, he was quite young.
Yes.
Yeah.
Absolutely. And again, because he'd suffered that stroke, he otherwise wouldn't have needed to be in an aged care facility. He still had that really great family support. It was just that because of his personality changes in association with his need for care was the reason why he ended up in that home.
And I imagine surrounded by much older, maybe not much older, but surrounded by older people.
Potentially.
So
It didn't
he
actually...
might have been viewing that as I shouldn't be here.
Potentially.
You know, everyone else is
Yeah.
20, 30 years older than me.
Yeah, I think that independence at the age of 60 would have been really hard to accept that he didn't have as much as he wanted anymore.
Yeah.
So on the 17th of December in 2016 at 5 a.m, Fred attempted to get out of bed without nursing staff assistance. He transitioned from his bed to his wheelchair and then attempted to retrieve an item out of the bottom drawer of his bedside drawers. As he leaned forward, he toppled head first into the drawer and his head became lodged within the bottom drawer.
Oh my God.
What was he trying to get out of the bottom drawer?
That is not documented in the coronial inquest, so I cannot give you that information.
Maybe he was cold in bed, so he wanted a pair of socks or a
It was
jumper
5 a.m. in the
or-
morning. He might have just been,
he might have been
up for
getting
the
up.
day.
That's just, I'm just picturing that happening.
I
and-
know.
Absolutely.
Wow. That would have been terrifying.
If he potentially went on that left-hand side, he then couldn't use anything to
Yeah.
brace himself because he
Yeah,
didn't
he
have
couldn't
that
put his
strength
arm
of
out
mobility.
to-
Yeah. And so he's just toppled head first into the drawer.
And is unable to get up.
Whoa.
Yeah.
And getting your head lodged in there, that would be painful.
Yes.
I'm trying to think of the physics.
Yeah, it just...
So what essentially is described is that his head has gone in the drawer and so his full face is in the drawer. And so like the top of his head is lodged underneath the next drawer up.
Yeah, and like
And
his
so he
chin
can't-
is against the edge of the drawer.
Yeah, where you'd like pull the handle.
Yeah.
And he himself
Can't-
cannot
yeah.
remove
And he's
himself
sort of
from
like
that situation.
face down.
Yes.
In the
Maybe
Someone
head
who had
tilted
full
or to a
mobility
side.
would have probably been able to get themselves out of that.
Yeah.
But
I
he
think
couldn't.
he was kind of primarily on that left-hand side, so couldn't use that to brace to get himself out, but couldn't get his right under to, to push himself out either.
Holy moly.
I'm guessing he wasn't supposed to be getting out of bed without assistance.
It actually doesn't really go into that, but
Okay.
I would. I mean, he could transition into his wheelchair. He did that on his own, but absolutely
no
there is
problems,
known issues with his mobility, and he suffered multiple falls in the home. So it doesn't actually go into what his care requirements were meant to be.
Yep.
So he's stuck in the drawer, and he then called out for assistance from the nursing staff that were available. He was attended by an enrolled nurse and a personal care assistant who were staffing the aged care facility for the overnight shift, because remember this happened at 5 a.m.
So there were only 2 of them on shift at that point.
Yes.
Do we know how big this nursing home is?
It was a 34-bed or 34
Okay.
resident facility.
So it wasn't huge.
No.
I'm just thinking a 200 resident facility with 2 people, 2 staff.
No,
Not
yeah, it was 34 residents, so 2 staff was the standard for an evening shift. But it is worth mentioning, an enrolled nurse. So I don't know if you guys know much about nursing structure, but enrolled nurse is your...
It's different than a registered nurse.
Yeah, they've got a bit more experience.
Yes. This enrolled nurse had her medication endorsement because they wouldn't have been necessarily able to have an enrolled nurse alone unless they had a medication endorsement to work overnight.
Yeah, makes sense because residents might need medication overnight.
Potentially. Yeah. And a personal care assistant is someone who, in this inquest, it kind of describes similar to just someone to help the residents around. And when they sort of had information coming from the aged care facility, kind of that encouragement of someone to help them out like it is their home and to make it more an assistance versus a health care kind of individual.
So would they be helping them with like showering and toileting? And
Potentially,
like getting
yeah.
around, getting to the dining
Plates.
room.
Yeah.
I need a blah, blah, blah from this room. Can you get it for me?
Exactly. And for the rest of the podcast, I'm going to refer to the nurse and the assistant. I'm not going to continue to say enrolled nurse or personal care assistant because that will get tedious. So they attended and found Fred with his head lodged in the bottom drawer. And at this time, he was yelling for them to assist him to get him out.
Yeah,
To
he
help
would have
him.
been stressed is
Yes.
probably an understatement in that
Yes.
situation.
Moderately distressed. So they attempted to assist him, but he was flailing and thrashing and making it unsafe for them to help.
Right. He wasn't staying still to let them pull him out. He was trying to get himself out, which he couldn't.
Yes. So because of that, the nurse asked the assistant to retrieve the facility's lifting machine in a hopes that they could use a person lifter to try and get him out, while she then phoned the emergency services for ambulance officers to attend to help them as well.
Yeah.
And ultimately the assistant bought the lifting machine, but by then they'd kind of decided that actually wasn't going to be of help, so abandoned that. But the nurse made the phone call to the emergency services at 5:10. And at this point, the nurse had assessed Fred as being stable, but at risk of further injury due to the position he was in. But the nurse didn't take any vital signs or baseline clinical kind of observation of him, just said, he's alert and talking, I just can't get him out.
Yeah, which you can do that without having access to someone's head. You know, you could assess his heart rate And his respiration rate.
Yeah, but it was also
But also,
mentioned
if
that
he's still flailing around, that's going to be hard.
exactly. So I find that a little bit sort of, it would have been hard to establish. I absolutely understand that potentially was hard in that exact moment. The call resulted in the nurse being instructed for Fred's safety not to move him unless he were to deteriorate, and that someone should remain with him while someone should also go to the entry of the facility so that the ambulance officers can be directed to his room once they do arrive.
And are we thinking that the thought they were saying don't move him is that he might have had a neck injury of some kind?
Yes. They were worried that he was injured, and the emergency call taker was of the understanding that this was a fall. And so if it was someone that was fall that they can't get up, they're like, just keep him there. We'll come help and assess the situation when we get there.
Yep.
Unless things change, at which point call us back to say there's deterioration or there's a change.
Yep.
And we can instruct you further as to whether, okay, that's the point where, sure, he does need to, in fact, be moved for his safety. The nurse elected to proceed to the front of the building, leaving the assistant with Fred.
I probably would have done it the other way myself.
We'll come to that. We will come to that. At 5:19, the nurse received a phone call back from the emergency services asking for more details about Fred's position. This was made by so initially it was emergency call taker, and this was actually a call back from a paramedic services individual.
Okay. So someone with a bit more
Medical understanding, yeah. The nurse stated that she was not with Fred as she was waiting for the ambulance at the front of the facility, but she didn't know what was stopping him or preventing him from being moved.
Yeah.
Right. She hadn't established whether he was lodged or whether it's just that he couldn't get up himself.
Yeah. The nurse reported at the inquest that she'd attended to other residents and frequently returned to Fred's room for verbal confirmation from the assistant that he remained stable, and then that she was returning back to the front of the facility looking out for the ambulance. The assistant provided in her statement that at one point she reported to the nurse that Fred had gone quiet, and the nurses assessed Fred at that point and stated that his pulse was weak before then leaving the room.
No, at that point when he's quiet and not flailing, you get him out of there.
Yeah.
This was disputed by the nurse.
Okay.
But we'll return to discussing more around that later, because that comes up in the coroner's recommendations.
Because I'm guessing they're not taking notes while this is all happening.
No.
This is based on their recollection after the fact.
And the inquest was 2 years after his death.
Yeah.
So,
Oh, right. Yeah.
Yeah. So the ambulance arrived at 5:40, remembering that first phone call was made at 5:10. So it took an ambulance half an hour to get there. The paramedics located Fred lying on his left side with his head in the drawer and his neck bent over the edge of the drawer. His airway was fully occluded and he was not responsive.
That's amazing that he remained responsive for that long.
I
Well, I
suspect
guess he
something
would've-
might have changed that
Yeah, he
ultimately
might have
then completely
moved.
occluded his airway. Yeah.
Yeah, I was about to say, and also like he's flailing about, he's
Yeah, he would have
moving,
been
whereas
moving
like
himself.
once he starts losing consciousness, you'd assume like the body weight would
Slumps.
press down
Yeah.
and start.
Yeah,
Or
it's
might have
relax.
partially occluded, so it took that time, etc.
Yeah.
Wow.
The care assistant stated to the paramedic something to the effect of, I think he fell asleep. The paramedics were able to remove Fred's head from the drawer. He was placed on the floor before CPR was commenced, as he was no longer breathing and no longer had a pulse.
I think he fell asleep. I don't think anyone could fall asleep when
In
they're
that
under that kind of.
position.
He's got that much adrenaline coursing through his
Yeah,
veins.
there's no way he's just fallen asleep.
No.
That's what the paramedic recalled, was stated by the assistant. After CPR had been commenced, the paramedics requested further paramedic attendance. However, CPR was ceased shortly after, as the nurse was able to obtain Fred's advanced care directive, which stated he did not wish for CPR in the event that he was found pulseless and not breathing.
Okay.
And so hence he was ultimately pronounced deceased at this point. So the coroner remarked on 4 main points when addressing that she had identified that Fred's death was in fact preventable. She addressed the falls prevention mechanisms in place within the aged care facility, the staffing shortcomings, which we've kind of talked about, the emergency services advice of not moving him, and then the CPR cessation. As we know, Fred was at risk of falls due to his medical history. He'd had previous falls. He was known to fall. Ultimately, Fred's wife did speak pretty highly of the facility and the care that they'd provided for him. So it doesn't appear like there were significant concerns around his falls and the care that was provided to him. That this ultimately just ended up being a freak accident that happened that no one would have expected. But that being said, the facility assessed this event and it had implemented measures to try to prevent injuries with the drawers in the residence rooms in the future with regards to rearranging the furniture to make it less likely that someone would fall headfirst in, which I have to say is one of the most interesting things that I think anyone could ever do in their job, being like, today I am going to double check that no one can fall headfirst into this drawer.
Or a new staff member coming in there and be like, why do you have the chest of drawers positioned there? And they're like, to make sure no one falls head first into them.
Yes.
New staff member says, huh?
Yeah. But I imagine they also looked at other safety aspects of the furniture in the patient's room, which is absolutely necessary.
Makes sense.
Just think that one particular scenario of what in fact happened to Fred is just so outrageously unlikely to happen.
Yeah.
Much like the pedestal fan situation.
Yep.
Yeah, that's exactly
Where
right.
you
Had to be exactly the right distance away from it, the right fall, the drawer had to be open a certain amount because otherwise he would have just hit his head on it
Yeah, exactly. So
and not got lodged. If it was out further, then he wouldn't have maybe gotten stuck.
exactly.
If he'd fallen on his right side, maybe he would have been able to get it out.
Get himself out. Absolutely. Yeah.
Wow.
Was there any discussion around any sort of falls mitigation strategies?
So I think it's pretty standard for aged care facilities to have that in place, but they didn't go into much more detail around Fred's fall mitigation perspectives or anything like that.
Because whether he had one of those sort of fall buttons, that
Yeah.
he
He was able to-
people's necks.
He was able to call out though. So
Yeah, true.
They
Like,
were able to
they
attend to
did-
him pretty quickly.
Yeah,
and
I
that
was
kind of
thinking that
thing.
he had fallen and they'd not
been
known that he was there.
Yeah.
Yeah,
But no, they did actually hear him.
Yeah.
They were able to get to him. They just didn't.
they were unable to do anything.
Yeah.
Okay, so moving on to the staffing and their training and the shortcomings there. So the enrolled nurse and the personal care assistant were the only two staff rostered for that overnight shift. And as we mentioned, there were 34 residents in the facility, which was thought to be an appropriate number of staff overnight for when presumably most people are sleeping. But we've also got to recognise that residents in an aged care facility also may have an element of dementia. And so that can mean that those overnight shifts can be a bit more hands-on than potentially other care facilities.
What's
'cause
that a ratio of 1 staff per 16?
Yeah.
Yeah.
Thank you for mathing because that's 17? 17.
17.
17, yeah. So not great mathsing there.
yeah. But yeah.
Because, if someone, say, had just fallen normally and needed help up, they probably would have used 2 of them to get them up. And if someone else
That's right.
at
And
the
then you're
same
leaving-
time,
33 patients unattended.
And I want to highlight that one of them was a nurse and one of them was an a personal care assistant.
yeah.
So,
So
remember,
one
she
had
was
medical
there
training and one did not.
she was there to help people around the facility, She
Yeah.
wasn't medically
Yeah.
trained.
And should not have been expected to.
Be medically trained.
Yeah.
No. So the enrolled nurse had been working in the profession for 30 years, the last 6 in aged care. She obtained a medication endorsement, as I mentioned, across that time. And so she'd been a nurse for a while. She had the skills and the knowledge and the background to do that job appropriately. She obtained her employment with the aged care facility through a recruitment agency agreement. And she'd been working essentially only night shifts for the previous month at the aged care facility. At the time of the inquest, she was unable to state if she received an induction when she began at the aged care facility. But
This
let's
again.
remember it's 2 years after the event.
And she'd been working there for
And she
how
only
many
worked there for a
years?
month, and it was through an agency that she ended up working in that facility. So if she'd been working at multiple facilities, it's been a long period of time since she worked there. Don't know how much work she did there after this event, all that kind of thing. I can understand how she could not remember. But hopefully they had given her an induction into the facility. But it's really hard if you
Did they
only
not have
work
any
night
records
shift.
of whether they'd given her an induction?
Unclear. Nothing was mentioned about there being obvious documentation that she had or anything like that.
Yep.
But, if you start on a night shift and there's no one else around and then you continue to work night shift and never actually work during the day, I can see how that would be difficult.
Yeah, you'd hope there'd be some, when you start, some level of you're not alone on your first shift, or you know what I mean? Like you'd
But
hope there'd be
potentially
some-
she was, if there was no one else to staff
Yeah.
or be there with her.
Yeah.
And she's an experienced nurse, so in theory
Yeah.
she doesn't need someone to
It's
supervise
more just
her.
pointing out, here's the bathroom, here's the kitchen, here's
Yeah.
where the drugs are kept.
here's where, when shit goes wrong, the folder that tells you who needs to be contacted and what potential things you need to do.
Yep.
Yeah. The personal care assistant had obtained her Certificate 3 in Community Services Aged Care through TAFE Queensland 6 years prior to Fred's death.
Okay.
The assistant did not attend the inquest, but rather provided a statement to the court. Hence, details about her involvement were only able to be taken from the statement, and further questions were not able to be answered, leaving facts unknown, such as whether she herself had a first aid certificate or not.
One, I'd hope she had a first aid certificate working in that environment. Also, I thought if you were involved in an inquest, you had to turn up to answer questions.
Yeah, so this is a bit that it didn't go into, and it didn't tell me why she wasn't available. But I can understand maybe if there's a health reason or if she's moved state, that kind of stuff.
Yeah.
She's provided a written statement
Of her account of the event.
But surely you'd still be able to provide oral evidence by virtual link or something.
Yeah, you would think so. When did this inquest actually happen?
2018.
Yeah, that definitely would have been the facilities.
But yeah, I don't know why. You were saying you would hope that that was a requirement?
Yes.
A first aid certificate was not a requirement for employment at some aged care facilities, but was rather a suggestion generally as a requirement.
Yeah, look, I suppose that's fair. When I worked in aged care in the kitchen, I didn't need a first aid certificate, but I was also not allowed to help
or interact
move
with the residents.
Yeah, like you could talk to them, but you weren't allowed to move them. Like if they were in a wheelchair, you weren't allowed to wheel them back to their room or anything because that was not your job.
Yeah.
Yeah, I mean, she was in a care position.
Yes. Yeah.
But again, it wasn't a requirement of her employment, and we'll come back to that.
Yeah.
So overnight, along with the nurse and the assistant, a registered nurse, so more senior and more experienced, was on call and available by phone. And the one that was on call of that evening was actually 10 minutes away from the facility. But this individual was not contacted at all during Fred's incident. And he stated that should he have been contacted, he would have provided advice around Fred's care, including completing a clinical assessment of Fred, and that he would have absolutely attended the residence and possibly could have arrived prior to the ambulance, given he lived close by. But
I always have issues with that kind of thing where they're like, this is what I would have done. It's like you've had time to consider your actions. Where and I'm not saying that what they did and how they responded was correct. I'm just saying hindsight's always 20/20, isn't it?
Absolutely.
He's definitely had time to think about what he should have done had he have been called.
Exactly right. But whether
You'd
he
hope that he would
that.
have done that in that situation, but this is saying, yes, I definitely would have done everything by the book.
Exactly. And it's so hard to, say that definitely would have happened.
Yeah.
And all of these inquests are all with hindsight. And so you make these recommendations, be like, cool, but at that particular point in time, just it didn't work out that way. And so, sure, in a perfect world, I would have, I could have, I should have. And so it's really hard. Talking about you guys being like with the benefit of hindsight, he did ultimately conclude that he would have recommended emergency services be contacted as the priority. So
which is what they did.
Which is what the nurse did. So, if she'd been on the phone to the emergency services the whole time, she wasn't going to be able to contact him anyway.
Yeah.
So, but he was just saying, I could have been there. I could have been an extra set of hands. Our protocol is that I probably should have been contacted, and that we will try to make sure that that occurs in the future, should future events happen overnight. So the major contentious issue that was examined by the coroner was the nurse's decision to leave the assistant with Fred rather than remain there herself.
Yeah.
And ultimately the coroner said that she was of the highest skill level, and the assistant's possible lack of being able to assess a deteriorating patient, given she likely did not hold a first aid certificate, was a poor choice for the nurse to have made.
Yep.
In the nurse's defence, she stated that she left the assistant as Fred was more familiar with the assistant and therefore felt that that would be better for Fred, and also that she had the skills and was better equipped to manage others in the facility as the event was occurring, so that she could take care of the others around while the personal assistant stayed with Fred.
Because I'm guessing she wasn't thinking at that point that it was life-threatening, just that they needed help getting him up.
It appears that way.
Potentially, yeah.
Which I think, again, is another sort of point that the coroner made, that she maybe had misjudged how much of a risk Fred was in.
Yeah.
So the fact that the nurse felt that she would be better equipped to manage the others in the facility was disputed by the registered nurse who knew the assistant. saying that she was in fact capable of managing other residents and could have been left in charge of doing that. And an expert witness also commented saying that the more senior staff member should have been the one to remain with Fred so that they could assess his clinical situation. The coroner also felt that this event put the nurse in a situation beyond her decision-making capabilities, as evidenced by the decision she made on that night, and that she should not have delegated the monitoring of Fred to the individual who did not have basic first aid principles.
Yep.
The coroner felt that the aged care facility's adherence to minimum staffing requirements was a large contributor and recommended a registered nurse be located on site at the facility 24 hours of a day.
Yep.
And then also made the recommendation that government departments legislate minimum nursing staff to patient ratios and develop national standards describing the skill mix and staffing levels required to manage an aged care facility, and that personal care assistants should hold a first aid certificate prior to being employed in the aged care sector.
That's so interesting that they mentioned the recommendation being in relation to a national program. I'm just thinking again
not
that
just state level.
Yeah,
it's
not
national.
the state level, it's national.
When I go on and say, consequently, the coroner made a number of recommendations about staffing and skill levels in the aged care sector and ultimately referred her findings to the Royal Commission into Aged Care Quality and Safety, which occurred in 2018, which was the same time that this inquest was released. I think that's why it became a national recommendation, because she was saying, we are currently conducting a Royal Commission into this. We are aware that there are a number of issues with regards to staffing and safety in aged care.
Yeah.
So I'm going to go big on these recommendations.
Why not?
Yeah.
Because
Because it would be an issue everywhere.
It needs to be fixed. That Aged Care Royal Commission ultimately was released, and I'm going to link it in the podcast description. Should anyone want to read it, you're more than welcome to. The summary document was 115 pages, so I did not get around to reading it prior to this. So feel free to educate yourselves. I don't have any further to add to how many of those recommendations were actually taken up by that commission and that kind of thing. Apologies. I was like, yeah, I'll totally read this. And then I opened up and saw it was 115 pages and was like,
and that's the summary.
Yeah. I didn't even open the full commission to see how many pages that was because I was just like, nah, this is
Hundreds, if not thousands.
Oh, yeah. And look, I balked at the fact that this inquest was 43 pages long. So, you know.
Oh, really? I was about to say, all of mine are like almost 100 pages.
I know. So getting back, along with the staffing and the nurses' decision-making, the last thing that the coroner sort of highlighted as a concern, and if done better, potentially would have prevented his death, was the nurse's call to the emergency services. The coroner felt that her call did not adequately convey Fred's condition and that she did not make it clear that she was a nurse, nor did she provide any reference to the risk of Fred's airway or potential risk for respiratory compromise in her phone call.
Yeah, because it sounds like when she called them, she said, okay, yep, I've got an elderly person who's fallen over.
And he's stuck in a drawer.
As the call taker, you'd just be like,
what do you mean?
Okay, he's stuck somewhere, but he's fallen over and can't get up. Yeah, okay. Yeah, clearly didn't specify. He's stuck head first in a drawer.
Might be impacting his airway.
Yeah. I think she did say like head first in a drawer, but again, the consequence of his airway. And so this did make it difficult for the call taker, who's non-medical, who's not medically trained, to understand the risks posed by this event to Fred. So the phone call was received, and understandably that individual had difficulty ascertaining what the situation was described by the nurse, and ultimately, as I mentioned, categorized it as a fall. Now, when these call takers take their phone calls, there's a number of protocols that they can categorize each call under. They have a very strict script to follow based on which protocol they use, because they're non-medical, to get it through to the level of what kind of ambulance am I sending out, what level, what category. And so a fall is protocol 17, but wasn't entirely following the script, which was a bit of a debate around. They went slightly outside of the script and whether that was permissible. And the main bits there being that the nurse went on to then reassure Fred that an ambulance was on the way, and the call taker didn't, because it wasn't in the script, notify her that wasn't in fact the case, that they had referred the phone call onto the second paramedic that called for that to then establish the priority of the ambulance.
So when they called initially, the ambulance hadn't been sent. It was only when the second paramedic called that
It was categorized as a priority 3,
Okay.
which doesn't necessarily initiate the leaving of the ambulance. It's when there's an appropriate ambulance available,
they will go.
They will go. When the second paramedic called, they ultimately upgraded based on the information that the paramedic got from the nurse. But again, the nurse was still not clear about the dangers that Fred was in. And so again, it only got categorized as a priority 2, which meant it took half an hour for the ambulance to get there. And so ultimately they found that the initial call taker probably should have categorized it as a protocol 22, which is an entrapment, and that would have led to a priority 1 ambulance being dispatched,
Right.
which would have led to a much faster response from paramedics. And so at any point, had the nurse mentioned that there was a risk of airway obstruction, this probably would have led it down that category and would have potentially changed that outcome as well.
Right.
And then also the other thing is the call taker mentioned to call back if there was any change in his condition, which did not happen despite the fact that clearly his condition changed at some point before the paramedics arrived. And again, with that, maybe something would have actioned quicker. But with the benefit of hindsight, that's easy to say.
Yeah.
You know? And obviously the coroner had gone through all of the recorded audio for this. And, you know, in the first phone call, the coroner could hear Fred calling out. And they were aware that Fred was stable at that first phone call. And so, again, that's what sort of deprioritized it being an urgent event because he was clearly stable but at risk at that point in time. Oh, yeah, finally, there was also just a quick chat around the cessation of CPR. So the coroner kind of just mentioned, well, he'd said when he came into the nursing home, he signed his advanced care directive saying, yes, I do not wish for any attempts at resuscitation should I be found pulseless and not breathing. But his wife sort of mentioned, well, when we had that conversation, it seemed in the context of he's had a previous stroke that if that were to happen again, he would not want to continue living with the deficits, much like what he currently has.
Or if they came across him, he didn't get out of bed in the morning and he died in his sleep.
Yes.
He didn't want CPR then.
Absolutely.
It wasn't he's fallen over.
He's fallen headfirst into a drawer.
Yeah.
And
been alive, stayed alive for a period of time and then died.
And so the coroner sort of separated that into a natural versus unnatural event that would have led to his passing. And ultimately the expert witnesses that were involved in this inquest said, well, no, they still did the appropriate thing.
That's exactly right.
It was very clearly documented if he was found pulseless and not breathing that he did not want CPR, and so that it was well within their right and appropriate for them to have stopped and not continued with CPR. Yeah. But that advanced care directives should have some documentation or some distinction around events that this should be used for. And that if it were to occur in a state that was different to that was not expected, such as an accident or injury, then there should be some more detailing around that so that families and the individual signing these documents are aware and that decision-making is assisted at the time when those events do occur so that they can feel more confident about making the right decision when that did happen.
But there's also a balance about making it not too complex because you think about if you're in this situation and you're trying to get the paperwork out and you're reading through it and it's like with item 62B, you know, I do not wish to.
Yeah, so yes, still having to be broad, but saying if this is a natural.
But then what's categorized as natural and unnatural? Like it does get, like I completely understand like blanket advanced care directives, how they were definitely well within their rights to stop.
And it was a directive that, you know, he'd been given on his entry to the aged care facility where they went, we've got to fill this document out. It's got what do you want in end of life care? It's got what do you want if you're found deceased? And it's got some other general sort of information. And so the coroner was also like, I'm sorry, and they get this on entry. But the aged care facility, rightly so, were like, well, we'd rather make sure it's taken care of than let it linger or bring it up at another point that makes it more insensitive rather than this is just...
You've got a, you know, you're now ill, like very ill, you've got pneumonia or something. Here, fill in this paperwork.
Yeah. It was like you're coming here, we just have to know your wishes in case anything happens.
Yeah. And who has to follow an advanced care directive? Is it any medical personnel or any people whatsoever? Because like you could have an advanced care directive and go out onto the street and fall over and a member of the public comes to help you.
I guess it would be any individual that knows that answer.
Yeah, I mean, you can't reasonably expect a person out on the street to know that you've got an advanced care directive.
And so in this case, the paramedic started CPR because they didn't know the answer and then said, can someone find this answer? Because we're in an aged care facility where it'll be likely that information has been documented.
Yeah. Mm-hmm.
And so that's how that came about in this case. But yeah, so that is Fred's case of an unbelievable, bizarre accident.
Yeah.
That
had
really
it have happened to anyone else may not have been fatal.
Absolutely. And really there were some key steps there that did really mean that this didn't need to have ended this way.
Yeah, I definitely thought it was going to be that he fell, got lodged, and then either he was at home by himself and no one found him, or in the aged care facility he couldn't call out and no one found him. I did not think that someone was going to be there.
And how heart-wrenching that is that someone had to go through that if she didn't feel she could help because she didn't have the requisite skills.
Yep.
And same with the nurse then working as well, not feeling confident, comfortable, able to manage that situation either, which is really, really sad because potentially the staffing was not adequate.
Yep.
Mm-hmm.
And so that's really devastating.
Because you would assume a personal care assistant would be cheaper
Absolutely.
than an enrolled nurse and definitely cheaper than a registered nurse.
Yeah. The inquest was talking about the ways that a personal care assistant is trained and becomes employed in an aged care facility. And part of the recommendations that the coroner made was around their training needs because it was very ad hoc. That some facilities would say, we'll hire you and we'll train you. Some were, you need to have this certificate 3 in community services aged care. Some were, you definitely have to have a first aid certificate. Others, it wasn't like an absolute requirement. So the coroner was absolutely like, we need to define entirely what this role is and what it is there for. And it's not there for health services for these members of the aged care facility. They're there as assistance for people who are living in what is technically a medical service.
Yeah.
And so it was also around the aged care facility suggesting that, no, we're trying to be like a home environment. We want to remove the medicalisation of it. But the coroner rightly stated, Fred was only there because he could no longer be cared for in his own home.
Yep.
So he needed more than his own home.
Yeah. He needed the medical care.
Medical services. And so you've got to weigh those risks and benefits of, yes, staffing. So there is someone who can, hey, can you grab me that cup of tea because it's over there and I've got mobility issues versus I still need someone to take care of my medical care for me.
Yeah.
It's a really interesting case. I think everyone's heard a story of an aged care facility that they felt quite nervous, and understandably why lots of elderly individuals might feel nervous about going and residing in one. And so it's really nice to see that there appears to be changes trying to be made, trying to
and I mean the fact
benefit.
the fact that there was a royal commission into aged care facilities shows that it is definitely a systemic, widespread problem.
Yes.
And yeah, it would be interesting to know what came out of that royal commission as well.
I'll let you sit down and read that document.
And if any actions, I'm sure it has been implemented since then.
Yeah. And so, yeah, I really liked the coroner really hitting hard on those recommendations for this one, saying it's got to change. So, yeah.
Yeah. Thanks for telling us about it.
And just bizarre.
Very.
So bizarre.
Add bedside tables to the list.
Of things.
Very long
things,
list.
yeah, that you've got to be careful of from now on.
Basically everything in my house, yeah.
Yeah. I mean, there's lots of things with drawers.
But shout out to a good friend of ours who has recently removed his pedestal fan from his house because of the missing caps. So that does make me very happy.
We've saved a life already.
We are affecting change.
All right, cool. Well, we'll catch you guys again next time.